Hello, my name is Abigail Zerfas, and I am a doctoral nursing student at Palm Beach Atlantic University. Welcome to my presentation, Healthcare Economics, Issues with Nurse-Led Health Clinics. Young et al. Spells out many of the benefits of nurse-led healthcare clinics. To begin, it does address the American physician shortage. Currently, we are expected to have a shortage of anywhere between 54,100 to almost 140,000 physicians by the year 2033. This level is going to be even higher in rural areas, as well as in practices that purposely serve marginalized populations. This includes people of Black and Latino descent and is really common in low income areas. Another big benefit of nurse led clinics is the holistic and preventative care approach. Focusing on holistic care allows a heightened understanding of biophysical, sociocultural, and spiritual needs, and also focuses on health promotion. This reduces hospital visits down the line and can really increase the mortality rates of a patient demographic. Finally, a benefit of nurse-led clinics is the heightened utilization of an interprofessional care team. This increases teamwork as well as communication throughout the team to better serve the patient. While there is much focus on how nurse-led clinics better serve a patient, there are also many economic implications of this care model that are sometimes overlooked. The National Nurse-Led Care Consortium, or NNCC, represents 152 nurse-managed health clinics. This organization really highlights the ability of the Affordable Care Act to be combined with Medicaid coverage. This combination increases the financial viability of nurse-led clinics. Both of these coverage acts were expanded in multiple states and will continue to expand. A quote from SOFR 2018 states, "The more people who are insured, the more the clinics can get paid." This really represents the ability of nurse practitioners to get reimbursement and create revenue for themselves and for their practice. This increases the ability of nurse-led clinics to be a financial viable option. Next, the Medicare Access and CHIP Reauthorization Act of 2015 focuses on the reimbursement of clinicians based on patient health outcomes and quality of care rather than services performed. This really focuses on the ability of nurse practitioners to get a higher payout and earn more money when it comes to implementing their care and functioning in nurse-led practices. Services performed often benefits that of the physician, who is able to bill higher based on their standing. This does not necessarily mean that the services performed better serve the patient, it just means they were able to charge more. This is another reason why the financial viability of nurse-led clinics is continuing to increase, especially as more nurse practitioners enter the field. A specific example of how nurse-led clinics has succeeded financially was a study performed by Chapman et al. In 2020. This study focused specifically on psychiatric mental health nurse practitioners and found that upon fiscal analysis of the clinics selected in this study, there was a positive net contribution, meaning that they were able to make money and they were able to survive economically. The California Assembly Bill 890 is currently a catalyst looking to expand nurse practitioner scope of practice. This bill focuses on the autonomous practice of the nurse practitioner and is hoping to lead the way for the development of various entrepreneurial models of care delivery led by teams of nurse practitioners. The goal is for nurse practitioners to improve care access and provide care to underserved communities. This will include developing new care models as well as practicing independently. Another benefit of this bill is that it decreases administrative barriers. This includes removing physician contracts and contacts as well. Of course, this means that nurse practitioners will be functioning individually. This will also remove the excessive paperwork and behind the scenes action and increased time devoted to patients and serving the patient population. The goal of this act is to also increase profession recruitment, allowing more nurse practitioners to enter the field to address the care shortages. Economically, the California Assembly Bill 890 allows nurse practitioners to bill directly. This again increases their ability to maintain a revenue stream and be financially viable. This also reduces the expensive physician involvement and sign-off. To expand on the financial and economic impact of the California Assembly Bill 890, it is important to understand the current incident to payment model. This model requires that a physician must perform subsequent services to reflect his or her involvement and active participation in the management of a patient's care. However, as more nurse practitioners enter the field, and as more nurse practitioners have autonomous practice, this payment method is no longer useful or effective. The Assembly Bill 890 is extremely important as the growth of telehealth care continues. Especially with the COVID-19 pandemic, the need for telehealth care for things including medical, psychiatric, and follow-up care is extremely important. As more nurse practitioners take over this telehealth sphere, the involvement of physicians is decreasing, meaning that the current payment method of incident to payment isn't viable. Allowing nurse practitioners to bill directly will support the growth of telehealth services, which, as we know now, a lot of practices utilize this service. Experts do predict that this will continue even after the pandemic, as many people are appreciating the simplicity of speaking to a provider over an online forum. There are currently many barriers to nurse-led clinics. First and foremost is a variation of a nurse practitioner scope. There isn't any current federal regulation that sticks in all 50 states outlining the autonomous practice of nurse practitioners. While many nurse practitioners are advocating for this change, the American Medical Association is currently discouraging this idea. The American Medical Association does not agree that nurse practitioners should be able to bill directly and currently are fighting for their continued involvement in the billing practice. This may include support and the continuation of the incident to payment model. This, of course, as previously discussed, requires that the physician must perform subsequent services to reflect continued and active participation in patient care. However, if a patient is strictly telehealth or is being seen strictly in outpatient settings, their chance of being cared for by a MD is decreasing. This will remove the nurse practitioner's ability to provide full, comprehensive patient care. Another big barrier to this idea is culturally. There is a very misunderstanding of a nurse practitioner. This is also focused on public understanding and interprofessional relationships. Currently, the public doesn't fully understand the nursing profession, and despite being one of the most trusted professions in the state, there's little understanding of the differences in nurses and advanced practice nurses. Increasing public understanding of the nurse practitioner role and the scope of practice of this profession will increase the public support for nurse-led clinics. Public understanding can then allow more elected officials to support this cause as well. Next, that of interprofessional relationships and having both MDs and other members of care teams understanding the nurse practitioner role. This will help the medical team further support the involvement of nurse practitioners and understand the benefit of having them involved in patient care. Please consider the references I used for this project and explore any of the information that they have to offer. The use of nurse led clinics is not only good for our society, but also represents an ability to increase the financial viability of the American healthcare system.